All right, today we're going to try something a little different. We're going to become translators. Our job? To decode the really complex and, let's be honest, often frustrating signals our nervous system sends out when it's in distress. Specifically, we're talking about the pain that pops up in our head, face, and eyes.
So, here's how we're going to break it all down. First, we'll start thinking about pain as its own kind of language. Then, we're going to take a trip through the huge universe of headaches, map out the complex geography of facial pain, and then zoom right in on why the eye hurts. And we'll wrap it all up with a simple clinical rule that, you'll see, ties everything together beautifully.
Okay, let's dive right in. The main idea we're exploring here is that the pain you feel isn't just random noise. It's not static. It's actually a structured signal, a specific message that your nervous system is broadcasting, and physicians, and even us, can learn how to interpret it. And, the source material for this explainer just puts it perfectly. When the nervous system voices its grievances, it rarely does so with poetic clarity. I love that. It means the signals are definitely there, but they're not exactly straightforward. Our job is to find the meaning hidden inside that message.
So let's tackle our first big category, the headache. It is so important to get this. A headache is not one single thing. It's this vast universe of different conditions. The source calls it a symptom space, which is a great way to think about it, with tons of different subtypes.
The very first and most critical distinction a doctor has to make is this one. Is the headache primary or is it secondary? A primary headache means the headache is the problem. The brain's own circuitry is on the fritz. But a secondary headache? That's totally different. It's a warning sign, a symptom of something else going on in your body. And get this, the language used to describe these primary headaches is just so vivid. A migraine is called a trigeminal vascular storm. Just picture it, this electrical and chemical storm raging with your brain's blood vessels and nerves. A tension headache is described as a gravitational pull, and others can feel like an ice pick-like volley or a sudden, explosive thunderclap. This isn't just poetry. Each of these descriptions is a clue about what's really happening inside the nervous system.
And then on the flip side, you have the secondary causes. These are the warning signs. In these cases, the headache is basically your body's fire alarm, pointing to some potentially serious issues like an infection, a bleed, or dangerously high pressure inside your skull. Of course, it could also be something more common, like referred pain from your jaw or neck.
All right, let's zoom in now from the whole head to just the face. And what a complex piece of anatomical real estate this is. It's this crowded neighborhood where major nerves, sinus cavities, and your teeth all converge, which makes it a real hotspot for pain that can come from a ton of different sources.
I mean, just think about all the things packed into your face. The pain could be coming from an inflamed sinus, a bad tooth that's screaming for help, or your jaw joint. But it could also be radiating pain from a migraine, or even a viral infection like shingles that's decided to irritate a nerve. And sometimes the problem is the nerve itself.
And that brings us to a really intense condition called trigeminal neuralgia. The source calls it the lightning bolt of the fifth cranial nerve. And wow, that is the perfect description. It's this sharp, electric, debilitating pain, and it's often caused by something like a blood vessel pressing on the nerve or from damage to the nerve's protective coating. This is a pure, unfiltered pain signal coming straight from the source.
Okay, our final area to explore is the eye. And pain right here is super interesting because it sits at this busy intersection where two different medical fields collide: neurology, which is the study of the nervous system, and ophthalmology, the study of the eye itself.
So the big question is, where's the pain really coming from? Is it a problem with the eyeball itself, or the socket, like an infection? Or is the signal starting way deeper in the head, where all the eye's wiring connects back to the brain? It could even be referred pain from something like a cluster headache, which is famous for centering right around one eye.
So, with all these different possibilities, how in the world do you even begin to make sense of eye pain? Well, this brings us to a beautifully simple but really powerful clinical rule that helps cut right through all the complexity, just by looking at the eye. And here it is, the one question that helps unlock the puzzle. It's not about how much it hurts, or even exactly where it hurts. The first, most important question you can ask is simply this: is the painful eye red, or is it white?
And here is the rule. It's so elegant. If the eye is red, the problem is almost always ocular, meaning it's coming from the eye itself. But if the eye is white, the diagnostic puzzle just got a whole lot bigger. The pain could be coming from the eye, or it could be neurologic, coming from the nerves or the brain.
So a red, painful eye points the searchlight directly at the eye's physical hardware. We're talking about things like inflammation of the cornea, which is the clear front part, or the sclera, the white part of the eye. Or it could be a sudden dangerous spike in eye pressure, a condition known as angle closure glaucoma.
But if that painful eye is white, whoa, the list of possibilities just explodes. Now it could be a primary headache, like a migraine or a cluster headache. It could be inflammation of the optic nerve, or inflammation on the back of the eye where you can't even see it. It could even be a sign of serious inflammatory disorder that's affecting your arteries. A white eye tells you to think bigger, much bigger.
So what's the big takeaway from all this? It's simple. Pain is information. Your body isn't just sending out static, it's broadcasting specific signals. Whether it's the signature of a headache, the location of pain in your face, or just the color of a painful eye, there are patterns. And once you start to see the patterns, you can begin to decode the message.
And that kind of leaves us with this final thought. We've just learned how to translate some of the language of neural distress. So the next time you feel some of these signals, maybe you'll have a new way to think about them. The question is, what message is your body sending you, and are you ready to listen?